Medical plan changes updates, premium surcharges, dental, life, and AD&D, accidental death and dismemberment, long-term disability, 2024 rule changes, and some reminders for open enrollment today for you. All right, for open enrollment information first. So open enrollment is November 1st to November 30th. Remember, all forms cannot be received before November or after November 30th. You must use the 2024 enrollment change form for all changes and enrollments. If you're on one of our medical only groups, you want to use the 2024 medical only form. Remember, some changes can be made by PEBB My Account online, and you'll get a report at the end, about the middle of December, showing online changes. And also remember too, all changes will take in effect January 1st, 2024. We are actually doing in-person benefit fairs this year. We're going to start the season off here. It looks like next week here at UW on 23rd, 24th, and 25th. And then the following Monday on the 30th. You see the times are a little bit different than the past. This is going to be held from 12 to 7 each of the day, first 3 of them, and the last one is 10 to 5. And for our Western Washington people, here's a list of all the fairs in Western Washington. And you notice times are a little bit different there too. From 11 to 3 will be for the retirees. We'll take a little hour break, and for employees, it'll be from 4 to 7 p.m. So again, a little bit change in the format this year. We're going to try this out. Didn't have good attendance last year. We want to make sure that we have some time for everybody. So again, retirees from 11 to 3 and employees from 4 to 7 p.m. Taking a look at Eastern Washington, here's a list here. Notice Pullman WSU is a little bit different. They'll have retirees from 10 to 2 and employees from 3 to 6. But all the rest of them will be 11 to 3 for retirees and 4 to 7 for employees. As in previous years, we have the virtual benefit fairs, basically a benefit fair online. You'll see it there, have all the plans available for you, gives the benefit options and information via online experience. It's available all day. You can use your computer, your tablet, your smartphone. You have some informational videos, got forms out there for you. And again, that information was updated on October 1st, so it's out there right now for you. So again, virtual benefit fair is online and available for you right now. We did recently mail out the newsletter. So again, this is our really only notice about open enrollment for employees. Maybe the best thing to do maybe is download this and upload it to your website, because sometimes people see this stuff and just throw it away. But this is kind of where all the information about open enrollment sits. So again, I hope people will read this information, this newsletter, because it has some important information in there for them. Also, in that newsletter, we'll have information about notice of credible prescription drug coverage. Also, summary benefit covered notices in there also. As an employer, you want to make sure that you sign up for Gov Delivery. This is how we send information to your employer that you can also end up emailing messages to your employees. We always have them pre-filled out. I think usually about 10 to 15 through the open enrollment. They're already done for you. So they're just forward them on to your employees and have information about open enrollment. Again, you might want to sign up for Gov Delivery if you want to get these messages. And how do you do that? If you go to the benefits administrator website, you look at the bottom of the page, you'll see there it says notice and updates. Once you click on that, you'll see there on the right-hand side, it'll say stay up to date on PEBB benefits. and you want it there, and you want to register for Gov delivery. Here's a timeline for you. And you see here the open enrollment information was posted on the PEBB website in late September. Also, the virtual benefit fair online was out there too for people. We also sent out a letter about premiums increasing. Please pay attention to that because there's some changes in the Kaiser, especially Kaiser premiums for next year. We mailed the newsletter out. It's already out for you people. And then we're also going to send postcards out, it looks like on the 18th too, for let people know about the premium increases. And in late October, we're going to send out the spousal surcharge letters. So if a person needs to reattest to the spousal surcharge, we're going to send a letter out there at the end of this month for people. And also late October, we're going to have the PEBB 2020 forms available to order. Again, just go to the BA website, order materials, and you can order forms if you need to do that. And then we start the October 31st, a Gov delivery message you can forward on to your employees. We're going to send out a series of those messages out starting October 31st. And in November, again, the 1st of November, PEBB My Account will be open for 2024 changes. And also, too, those PEBB forms we posted online, including the 2024 Employee Enrollment Guide. And we're going to send out postcards again about the premium increases on the 1st and the 8th. And late November, they're saying that the 2024 Employee Enrollment Guide will be available to order. And in early December, open enrollment confirmation letters start mailing weekly. Again, for people making online changes, we're going to start mailing letters out to people to say, hey, they made changes online, confirmation. And in early December, too, we're also going to send that spousal surcharge grace period letter. And in mid-January, spousal surcharge will be mailed again, letting people know they'll pay the surcharge for the next year. So again, they get 3 notices out there. So please, if you have people out there need to reattest to spousal surcharge, they want to do that in the month of November and December. Here's a look at the enrollment guide for 2024. Guy looks like he's in shape. So next year, it's no longer contain enrollment forms and premium surcharge help sheet. We're hoping that Benefits 24/7 will be launching in January, and people start using that application in order to for people to do their enrollment. This is also going to implore employees to use PEBB My Account until Benefits 24/7 launches in 2024. So hopefully in January 2024, that Benefits 24/7 will be launched, and there'll be no need for forms. But the forms will still be available for people to use, but then it'll be an online enrollment for people starting in January. So what can people do during open enrollment? They could change your medical and or dental plans if you're enrolled in the full benefit package. They can enroll in PEBB Medical if they are previously waived. They could do this without proof of loss. During the regular year, you want to enroll outside of open enrollment, you requires proof of loss of other coverage. Also, they can waive PEBB Medical if they enroll in TRICARE, Medicare, or other employer-based group medical. Coverage under the health benefits change is not considered employer-based coverage, so they cannot waive due to that. Also, they can add eligible dependents off proof of loss, but if they haven't been on it before, You have to verify those dependents, and dependent verification is due by November 30th. For a list of valid dependent verification documents, they're available on the Benefits Administrator website. They can also remove dependents from medical and or dental plans. And they also change the tax status of a dependent, IRC Section 152. How can employees make changes? You have a change type on the left, and they all can be done with the 2024 enrollment change form. There's one thing that you cannot do through PEBB My Account, and that's add a dependent to medical or dental that has not been on before. So again, you cannot do that because again, you have to verify those dependents. So unfortunately, currently, you can't upload that through PEBB My Account. So again, you'll have to use the enrollment form to enroll those dependents and provide dependent verification. You can also attest a spousal surcharge. You can do that through the form, and you can also do that online for the month of November and December. And you could change the tax status of dependent. Unfortunately, you can't do it at PEBB My Account, but you can use a declaration of tax status form to change the tax status of a dependent. So if a person does make changes online, again, they must be completed by November 30th. Okay. But what we want people to do is make sure they go all the way to the end when they make changes online. Sometimes people will stop just before it and don't go all the way through. What you want to do is either get a screenshot of your changes you made or print a copy of the confirmation. That way, if something happens, it doesn't go through, you have proof you made the change. So again, get a copy of the screenshot there, save a screenshot, or print a copy of the confirmation to prove you made the change. So you can use PEBB My Account at any time during the year. You can view their current information, your medical and dental coverage, your basic life and AD&D insurance. Remember, your supplemental life and AD&D is available through MetLife's portal. So again, you want to view that through there. And then also long-term disability. If you're enrolling in long-term disability, the employer or employee paid is also listed on PEBB My Account. You can subscribe to email notifications from PEBB. So for myself, I have a newsletter. They notify me when the newsletter is available, and I just go online and just download it and view it online. They can also print out statement of insurance. Again, a little reminder about the statement of insurance. It's only going to view current information only. So if they make a change online during open enrollment, it won't display until January 1st, 2024, when the changes go in effect. They also can attest to tobacco use premium surcharge anytime. So again, when a family member or a dependent who's age 13 or older has a changed tobacco status, they can use PEBB My Account to attest to the tobacco premium surcharge. So what can't you use PEBB My Account for? Again, you want to add a dependent who's not currently enrolled in medical or dental coverage, again, because they need to provide dependent verification. At this point now, you can't upload dependent verification to PEBB My Account, so you have to use a paper form and give a form to their employer and have a dependent verification too. Also, if they need to make an address change, you want to make sure you submit that address change to the employer. Unfortunately, you can't use PEBB My Account to do that. Also, removing a spouse or state registered domestic partner due to divorce or dissolution of partnership. The reason why we don't want people to use PEBB My Account to do that, because the COBRA packet is not sent out that dependents removed online. So yeah, so please, if they have a spouse or state registered domestic partner that needs to be removed from their coverage, we want to make sure they use a form currently in order to do that. Also, for making changes to life and AD&D insurance coverage, you want to use the MetLife My Benefits portal in order to do that. If you want to make changes to your HSA health savings account, Either you want to go to health equity, or you want to use a PEBB HSA payroll deduction form to make changes to your HSA contributions. So how do you find PEBB My Account? So what you want to do is go to the PEBB website, look under Public Employees. Once you click on that, you'll see under Public Employees it say PEBB My Account. But again, a little reminder that Benefits 24/7 will replace PEBB My Account in January of 2024. Keep your fingers crossed. So when you want to print out statement of insurance, once you log into your account, you see off to the right there in the green, you click on statement of insurance. They could either save it to their computer or they can print a copy of it off. And if you have Pay One access, you can also do a statement of insurance for your employees. Basically, you'll see subscriber SOI lookup. You provide the date of birth, last four social security number, and you continue there, and you'll be able to save it to your computer or print a copy of it off. So major changes online during PEBB My Account during open enrollment. Again, we're going to share a change report with you in mid-December of anybody who made a change online. So about mid-December, we're going to email your employer anybody who made a change online during open enrollment. All right. So how about medical plan changes? And we're talking about all the medical plans. We're talking about Kaiser and Uniform that are effective January 1st, 2024. Again, this information here will be in the newsletters, or you might want to contact the plan directly if you want more information about some of the stuff that we talked about today. The first one here is a cost share for abortion. There's no cost share for abortion of a pregnancy, except for the high deductible plans. We're talking about one for Kaiser Northwest, Kaiser Washington, and Uniform Medical Plan, CDHP plans. And a little note on that, that's Senate Bill 5242. That's in effect January 1st, 2024, if you want more information about that too. Also, increase the deductible for the high deductible plans, the CDHP, Consumer Directed Health Plans. This is beginning January 1st, 2024. Currently for a single subscriber, it is $1,500, but for 2024, it is going to go up to $1,600. And currently now for family coverage, it is $3,000, and effective January 1st, 2024, it's going to $3,200. All right, so we're going to focus on Kaiser right now. And this Kaiser Northwest and Kaiser Washington. As far as cost share for certain breast examinations, there's no cost share for supplemental breast examinations or diagnostic breast examinations. Again, at the bottom of the screen there goes a Senate Bill 5396 that goes into effect January 1st, 2024. And changes specific to Kaiser Washington. You see the benefit there on the left. You see chiropractic, spinal manipulations. Currently, right now, is 10 visits a year. And starting in 2024, it's going to go to 24 a year. The acupuncture right now is 12 a year. And going to 2024, it's going to go to 24 visits per year. For massage therapy, right now, as far as combined visits for that, you're going to break that out and give it 24 visits for massage therapy for 2024. Currently now it's combined for massage, physical, occupational, speech therapy, 60 visits, but we're going to carve it out, have its own separate benefit, and it's going to be 24 visits a year. And treatment for disorders, again, after the deductible, no member cost share currently for that treatments there. But starting in 2024, after the deductible, member will pay cost share for treatments of disorders. And for telehealth, right now there's no copay, but starting in 2024, there will be a $10 copay for telehealth. And the first fill program right now, you get to have to do the first fill program, but starting next year, that first fill requirement for maintenance prescriptions will be removed and can be refilled at any network retail pharmacy. And for Kaiser Washington Sound Choice, they got a benefit change as far as primary care office visit copay. Currently, there's no copay in 2023, but starting in 2024, there'll be a $20 copay for those office visits. We're talking about Kaiser Washington Sound Choice. And let's take a look at the Uniform Medical Plan. So we have some service area changes for the UW Medicine Accountable Care Network. It is leaving Kitsap County, and that's going to impact 268 members. They are entering Benton and Franklin counties. So the service area for 2024 will be Benton, Franklin, King, Pierce, Skagit, Snohomish, Spokane, and Thurston counties. As far as the Puget Sound High Value Network, there's no change in the service area. It will remain in Kitsap County. And here's a list of the 2024 service area for Puget Sound High Value Network. Again, that's Chelan, Douglas, King, Kitsap, Pierce, Snohomish, and Yakima counties. And as far as outpatient dialysis services for all UMP members, UMP members must pay the standard rate for initial outpatient treatment period of 3 months. And for UF plan members diagnosed with end-stage renal disease, again, this does not apply to UMP high deductible plan members. Basically, when the supplemental treatment period begins, the member pays 0% of allowed covered outpatient dialysis services. Member also will be able to, for Medicare Part B coverage, and have their Medicare Part B premiums reimbursed by the plan. Again, all the stuff here, you want to contact Uniform Medical Plan or Kaiser if you have questions about these benefit changes. As far as the COVID over-the-counter test, and this again was effective July 1st of 2023, so this is already in effect here for you. All UMP plans will cover up to 2 diagnostic tests per member per month, up to $12 a test. Again, this was in effect July 1st, 2023. And new members here will receive new cards for 2024. Again, that nurses phone line just changing from most plans. And also the UMP high deductible plan deductible changes. So again, you'll receive new cards for most of everybody but UMP plus UW, who doesn't utilize a 24-hour nurse line through Regents. All right, so we're going to transition over to Deb, and Deb's going to wind it up for us.
Okay. I'm going to go ahead and share just a second my screen. So now I'm going to go ahead and cover a little bit about the consumer-directed high deductible health plans with a health savings account, which we call the CDHP with the HSA plans. So when employees are enrolled in a high deductible medical plan, they're automatically going to receive a health savings account that their employer is going to contribute monies into. And these amounts are not changing for the 2024 plan year. So they're going to remain the same at $58.34 a month for single subscribers and $116.67 a month for subscribers who have 1 or more enrolled dependents. And employees can contribute monies to their HSA as well, but the IRS does establish a maximum contribution that can be made to their HSA each year. And that maximum does include contributions from all sources. So this just means that the amount that the employer is contributing, plus the amount that the employee contributes, plus any wellness incentive that they receive or that they earn that's deposited into that HCA cannot exceed $4,150 a year for a single subscriber and $8,300 a year for subscribers who are enrolled with dependents. And there is an added benefit for employees who are age 55 and older that they're allowed to contribute an additional $1,000 per year above these maximums. And employees can change their contribution amounts anytime throughout the year. So that's not just during the open enrollment window. And that's just as long as you allow them to do this. Then if they'd like to do that, all they have to do is complete the HSA payroll deduction form or contact Health Equity directly if they are making those HSA contributions on an after-tax basis directly to Health Equity. So now we're going to move along to the Smart Health Wellness Program. So there will be some changes to our wellness program, with the biggest change just being that we're going to have a new Smart Health portal provider. But here is what's not changing. So the $125 wellness incentive and how your employees can go about earning the incentive, that's going to stay the same. So it's same requirements and deadlines will be in place for that. Activities and challenges won't be changing, and the wellness program name and the look and feel of the program won't be changing. But here's what will be changing beginning January of next year. So Limeade is no longer going to be our portal provider or the mobile app provider, and that's because we will be switching over to WebMD to provide these services. And really, the result of that is just that there are going to be some new features that weren't offered before. So your employees can kind of get a little excited about that. And so, like I said earlier, the Smart Health $125 incentive will remain for 2024. So what this means for your employees is if they earn this incentive, then that $125 will be applied at the end of January next year towards their 2024 medical plan deductible. For your employees who are enrolled in a high deductible medical plan next year, then their $125 would be deposited into their health savings account. And like I mentioned earlier, this $125 does count towards that IRS maximum for the employee's HSA. So that's just kind of important to know for your employees who do want to maximize their health savings account. They would need to take that additional contribution into account. And there are deadlines that are associated with when your employees have to earn their points to receive this incentive. So for subscribers who are just continuing their enrollment in PEBB Medical, or they've enrolled in PEBB Medical with an effective date from January through September of 2023, then they're going to have until November 30th of this year to earn their points to receive this incentive. And for subscribers who are enrolling in PEBB Medical with an effective date of October through December of this year, they're going to have until December 31st of this year to go ahead and earn their points. Okay, so now we'll do a quick update about the premium surcharges. So there is no change to the tobacco use premium surcharge, but there are some changes that relate to the spousal coverage premium surcharge. So the first change is that the attestation help sheet will be going away. So for employees who want to enroll a spouse or a state registered domestic partner, and that spouse or state registered domestic partner has coverage that's offered to them through their own employer, this help sheet used to be a tool that they could use to determine if this surcharge would apply to them or not. So beginning in 2024, we are just going to make this so much easier for you and your employees. So the 6 questions that used to be on the help sheet are now going to be included on the 2024 versions of the employee enrollment change form, the premium surcharge attestation change form, and in the 2024 enrollment guide. And remember that the Benefits 24/7 application is going to have the surcharge questions built into the application. for those employees who are adding a spouse and then need to attest to this surcharge. So that's another reason why that help sheet is not really going to be made available. And then there's also going to be a change to one of the criteria to determine if the surcharge will apply to your employee. And that's going to be the amount of the medical premium for their spouse or state registered domestic partner's own employer's plan. And for 2024, this amount has actually decreased to $117.81 per month as compared to the $137.76 for the 2023 plan year. And for those of you who are familiar with the attestation help sheet, this was question number 6. Okay, so now we'll just go over some reminders about our dental, life, and AD&D insurances. And just know that if you are a benefits administrator from one of our employer groups who is a medical only group, then this section on dental, life, and AD&D is not going to apply to you and your employees. So first, there are no changes to our dental plans. So the same plans are going to be available in 2024, and there are no benefit changes to the dental plans for next year. But here is that reminder that we remind you about year after year, that a couple of our dental plans are administered by Delta Dental of Washington. So that's going to be the Uniform Dental Plan and the Delta Care Plan. But just know that these plans are very different in the kind of provider networks that are going to be available to your employees. So for employees who are going to be enrolled in the Uniform Dental Plan, this is what we call a preferred provider plan, which just means that they're going to be able to pretty much see any dentist and their services are going to be covered. But for employees who would like to enroll in the Delta Care Plan, this is a managed care plan, which just means that they're going to have a more restricted network of providers to choose from. So we do ask that if your employees come to you with questions about which providers they can use on the plans, especially that Delta Care Plan, that you just refer them back to the plans, because it's really the plans who are going to have the most up-to-date provider listing. And there are no rate or benefit changes to our life and AD&D insurances, and that does include the employer-funded basic plans as well as the employee-funded supplemental plans. But this is a reminder that even though there are no changes to the rates for this supplemental life and AD&D, that premiums do change when an employee reaches a new age bracket. And then when that happens, their rate increase will not go into effect until January of the following year. And premiums also change when your employees elect to increase or decrease the amount of their supplemental coverage. And when it comes to this supplemental life and AD&D, employees can make changes at any time throughout the year. So they don't have to wait till open enrollment to do that. So this would include enrolling in coverage when they were not previously enrolled, increasing their coverage, decreasing their coverage, and just saying, hey, I'd like to cancel my coverage. I don't want it anymore. Just know, though, that if they are enrolling or increasing the amount of their coverage, that they will be required to submit evidence of insurability. And the only time that they would not have to do that is if they're in their newly eligible 31-day eligibility window. And to make changes, they can complete the MetLife enrollment form, or they can go out to the MetLife My Benefits portal online and do that. So now we're going to go over our long-term disability insurance. And again, if you are from one of our medical only groups, then this section will not apply to you and your employees. So first, there are no changes to our LTD rates or the benefits. So we're just going to cover some reminders. So just remember that your newly eligible employees are going to automatically be enrolled in the employee paid LTD at the 60% coverage level. And within their 31-day eligibility window, they can complete the LTD enrollment form where they can instead elect to enroll in that 50% coverage level or go ahead and decline the employee paid LTD coverage. But if they do not take any action within their 31-day eligibility window, then they will remain enrolled in the employee paid 60% plan. And just know that no evidence of insurability is required if they enroll in that 50 or 60% plan during their 31-day window. And even if they go ahead and decline the employee paid coverage, they're still going to be enrolled in the employer paid plan. And just a reminder that there are changes that your employees can make to their employee paid LTD, and this is at any time throughout the year, not just during open enrollment. So they can enroll in the employee paid coverage if they had previously declined it. They can increase or decrease their coverage level, and they can decline it, get out of it. They don't want it. However, if they are electing to enroll or increase their coverage, then they're going to need to provide evidence of insurability. And the way that they're going to make any of these changes is to complete the LTD insurance enrollment change form. Okay, so next we're going to cover some rule changes that are going to go into effect on January 1 of next year that will impact the way that you administer PEP benefits for your employees. So this is just an update to a current special open enrollment event, which is event number 10 on the SOE matrix. And it has to do with when an employee has a change in their residence, and then their current medical plan is no longer going to be available in their new location, that they're going to have to be, it's a must that they elect a new medical plan within the SOE timeline. Because if they don't, then the PEB program is going to automatically enroll them in a PEB medical plan that is available in their new location. So really the only difference with this update as compared in the past is that the employee was supposed to make a plan change when this happened. But beginning January 1st of next year, if they don't elect a new plan, then we will be doing this for them. And here is a new SOE event to be aware of beginning next year, that when the PEB program determines that there's a substantial decrease in medical providers that are going to be available in a PEB health plan, then the employee will be allowed to make changes to their medical plan. So just know that when this happens, it is the PEB program who will notify the employees who are impacted, and they'll go ahead and provide some instructions on how to make a new medical plan election. And if you would like more details about this new event, you can certainly refer to the 2024 SOE event matrix, and it will be item number 21. And it is already out on the PEBBA website. And the last rule change, or in this case, it's really a legislative change, relates to our PEB retiree insurance eligibility for our PERS, TERS, and SERS Plan 2 members. So currently, these Plan 2 members must meet their years of service requirement to retire from their state retirement plan and the age requirement. And then once they meet both of those criteria, they must also immediately begin to receive their monthly pension benefit. But beginning January 1 next year, these Plan 2 members are still going to have to meet their years of service and age requirements, but they will not be required to immediately begin receiving their monthly pension benefit. So for those of you who are familiar with how eligibility for the PEB retiree program works for our Plan 3 members, basically just know that this is how it's also going to work for these members come January. And if you start to get any questions about the eligibility update from your employees, we'd just like to share a couple of ways you can help them. First, you can refer them to the PEB retiree website to register for one of our retiree webinars, and we have provided a link to that webpage here at the bottom of this slide. Or you can refer them to our PEB customer service team directly at this 1-800 number. So in this next section, we're going to cover some reminders about the reattestation process for the spousal coverage premium surcharge. So the employees are going to be required to reattest to this surcharge for the 2024 plan year are going to be mailed up to 3 different notices from the PEB program. So first, we'll be mailing these employees a letter in late October, just reminding them that they're going to need to reattest to this surcharge for the 2024 plan year during open enrollment. And in that letter will be some information on how to do the reattestation and the important dates of when they're going to need to do that attestation by. And if they don't reattest during the month of November, then we will be sending another grace letter at the beginning of December, just encouraging them to reattest by the end of this year, which would be December 31st. And then again, if they haven't reattested by December 31st, then in January, we're going to send another letter, but that letter is just going to be to let them know that they will be subject to the $50 per month surcharge beginning in January 2024. And here's how your employees can do that attestation. So during the open enrollment window, which is November 1st through December 31st, they can do this online by using their PEBB account, or they can complete the paper form and then submit that to you. And here's just that reminder that if they don't reattest during this time frame, they will be defaulted to incur that $50 premium surcharge in addition to what they're paying for their monthly PEBB medical premium. And we do like to share this because inevitably you will get employees next year who did not do their reattestation. They're going to come into your office or call you and say, what is this $50 coming out of my paycheck? How do I get that removed? And the answer is that surcharge remains in effect for all of the 2024 plan year, unless the employee's spouse or state registered domestic partner has a change in their own employer-based group medical insurance that would then allow your employee to make changes to have this surcharge removed. So that really is why we send all those notices, because we want these employees to do that reattestation. And if you are keen into Pay One, just know that the Pay One system is going to automatically default your employees who are required to do this prior to open enrollment. So when you're in the Pay One system, the attestation is going to reflect a D for default, and it's going to stay that way if your employee does not do the reattestation. And if they reattest with a no, please be sure to enter the number that corresponds to the box that the employee checked on the reattestation. Because if you put any number except the number 6, this is going to result in that employee not being required to reattest in the future, which is kind of nice because it saves you some time as well as them. And if you are somebody who would like to know which of your employees are going to be needing to do that reattestation, and you would like to be a little bit proactive and reach out to them to be sure that they are doing this reattestation, here's how you can access the attestation report that will provide you with that information. So if you log into your own PEBB account and at the top, click on that subscriber SOI lookup feature and then click on the attestations report, it will download for you. And if you are a BA who doesn't have access to Pay One, then just reach out to us through the HCA support portal and ask us to go ahead and provide that report for you. Okay, so this brings us to the last section of our presentation, the annual open enrollment reminders. So just remember that dependent verification documents are due at the same time that enrollment forms are due. So that means no later than November 30th of this year for open enrollment changes for the 2024 plan year, no later than 31 days after date of eligibility, and then no later than 60 days after a special open enrollment event occurs. And if your employees don't submit that dependent verification documents with their enrollment forms, we just ask that you please reach out to your employee to let them know what you do need. If you have employees who are currently enrolled in a high deductible medical plan with that HSA, and they are contributing to their HSA themselves, and then they're going to be changing to any other medical plan for 2024, please just remind them that they will need to stop their payroll deduction to that HSA. Or if they're making direct contributions to Health Equity, that they'll need to work with Health Equity to get those contributions stopped. And just remember that an employee is not eligible to enroll in a high deductible medical plan with that HSA if their spouse or state registered domestic partner is enrolled in a medical FSA. And that's going to apply even if the spouse or state registered domestic partner is not enrolled in the employee's PEBB medical plan. Also keep in mind that if you have employees who are age 65 or older, or who will be turning 65 in 2024, that they really should be discouraged from enrolling in a high deductible medical plan with that health savings account without first talking to somebody about some professional tax advice. And that's because when these employees enroll in Medicare, that's when there can be tax consequences if they also have a health savings account. And it does get a little bit tricky because Medicare can be enrolled in retroactively as far back as 6 months, which just means if you have an employee who is enrolled in a high deductible medical plan next year with that HSA, they could get enrolled in Medicare retroactively while also having that plan enrollment. Also, when you get enrollment forms to add a newborn or an adopted child during the month of November, we just ask that you please key these as soon as possible before you enter open enrollment changes. And this is because if an employee did a plan change during the open enrollment window, which would have been in November, and then they have a new baby in December, the baby needs to be enrolled under the employee's current plan so that when January rolls around, the baby's also going to carry over onto the new plan that the employee elected during the open enrollment window. So if you process additions in December, so processing these in December 1st before you enter the open enrollment changes is just going to help make things a lot easier for the carriers. And when you're keying the child's effective date, just remember it is the child's date of birth, date of adoption, or the date that the employee is assuming financial responsibility. And if you are not able to enter a correct date of birth or adoption, we ask that you please don't key an incorrect date, but instead, once you have that accurate information, go ahead and contact us through the HCA support portal, and we will go ahead and key the birth date for you. Also, during annual open enrollment, we ask that you please keep an eye out for enrollment forms that are actually considered a special open enrollment event. So, for example, let's say you receive enrollment forms to add a newborn during the month of November. Well, you know that any forms that you're getting during the month of November are usually going to be for open enrollment changes that would not go into effect until January 1 of next year. But if you check the birth date of the child who's being added and notice that maybe the birth date is October 10th, that would be your first clue that this is really a special open enrollment event because you know that newborns are effective on the date of their birth. So that would mean that the child's effective date of coverage would be October 10th, not January 1. Which also means that you would need to be, or the employee would need to be enrolling the child on a 2023 enrollment form, not the open enrollment form for the 2024 plan year. We also ask that you keep your employee addresses up to date. And here's why, because this is the address that the PEBB program uses to communicate important benefits information to your employees, which we've listed some examples here. So for employer groups, if you key into Pay 1, then you're going to need to update address information in Pay 1. And if you don't key into Pay 1, then you send us address change information through the HCA support portal, and we update addresses for you. And if you still have questions, even after all of the information that we've shared with you today, here are some additional ways that you can get that information. So you can always reach out to us in outreach and training at the 800 number that's listed here, or you can refer to the PEBB website. Also, you can, from the PEBB website, you can go down to Gov Delivery by clicking on notices and updates. And that's where all of the information that we send on a regular basis is posted. So you can refer to it later. And like Larry said earlier, if you are not already registered for Gov Delivery, please do get registered because that is how we communicate all PEB benefits information to you. And you can also navigate to the HCA support portal where you can send us questions or upload forms if needed. And here's how your employees can get more information. So first, you're always going to be their first point of contact because we train you to be able to get their questions answered. So that's why we say, please don't send your employees directly to us. We like for you to get a hold of us. We will find the answer, get that back to you so you can share that with your employees. Also, you can refer them out to the PEBB employee webpage. And when they get there, at the top, there are some sections that are kind of highlighted. We change those on occasion. But right now, there's going to be all that information they need to know about open enrollment, an online virtual benefits fair if they can't attend an in-person fair, and of course, a schedule for the in-person benefit fairs. But everything they're going to need to know for open enrollment and everything about their benefits is going to be out here on the PEB employee website. And when your employees come to you for help with these items that are listed here, we just tell you right up front that to save yourself time and also to make sure that your employees are getting the most up-to-date information, please have them contact the plans directly. And that's going to be for questions they have about how do the benefits get paid? How much are they going to pay? How much is the insurance company going to pay? To request an ID card if they don't have one or if they need a replacement. Questions related to their claims processing, like what's the status of their claim or how are their claims processed? To find out which providers they can use with any of the plans and what prescription drugs are or are not covered on their plan. But here are the things that we ask you as their benefits administrator to assist your employees with. And that's going to be any questions they have related to eligibility for themselves and their dependents, how to enroll in the benefits, and then any important dates that they're going to need to be aware of in order to do that. Questions they have that are related to the premium surcharges and how those might impact them, how to find and complete the appropriate forms based on whatever changes they're trying to make, assist them with adding or removing dependents. And this would be helping them also understand if they're adding a dependent, which dependent verification documents they're going to need to enroll that dependent, any eligibility questions and questions about enrolling for the life and long-term disability insurances. And of course, any questions that they have about their payroll deductions that apply to their benefits. And this slide just contains some specific contact information and web links that can be used by you and your employees. And just know that all of this information is also available on the Contact the Plan section of the PEB website. And again, just some more contact information and website links that you and your employees can use. So we do like to ask that you keep in mind that during the open enrollment season and the few months after that is super busy for the PEB outreach and training team and all of our customer service team that are doing your enrollments and answering your questions. And we get a large number of HCA support tickets as well as phone calls. So we just want you to know right up front that it is going to take us longer to respond to those tickets, and your time on the phone when you call is going to have longer wait times. So we just ask your patience because we are working diligently behind the scenes to make sure that we respond to everyone as quickly as we can. And we also like to remind you, if you have not heard from us and you go out into a current HCA support ticket that's still open and you open it up and you say, hi, what's the status of this ticket? I haven't heard from anyone. Our ticketing system applies the date that you made the last inquiry on that ticket as the ticket date. And because we respond to tickets and the date they're received, now that ticket just got moved to the bottom of the line, and it will take us even longer to respond to you. So just know that we are not overlooking your ticket. We are responding as quickly as we can, and we will eventually get to you. And we do ask that you kindly, please do not share with your employees any of the information that we've listed here on this slide. So that's going to be the PEB outreach and training number or our PEB customer service number, because that really is for our retirees and our COBRA or continuation coverage members. Also, please do not refer your employees to the HCA support portal for their benefit questions, because that's really just designed for you as a benefits administrator. And also, please do not share our individual emails or phone numbers, and we do thank you in advance for this. Okay, so that was a lot of information. So now it's time to make sure we get your questions answered. I'm going to check in with Larry and see where we're at, if we need to answer anything outstanding.
Well, people just want to make sure that they get a copy of the presentation.
Sure.
So they've been
Okay.
sent an email. So
yeah, I see that.
we'll
So
send
there's
it out.
two. You betcha.
Yeah.
So I have
there's more in there too.
Right. Okay. I have a handful that I will make sure, but I'll look through all of the comments if you added your email. But just know that I went in yesterday. If you were registered, I picked up all of those emails and sent this already. So if you may have registered later, or sometimes we do run into some issues where I send it and it doesn't get there, but I will certainly make sure it gets sent out again. I do see a question here, though. I'm a little unclear on the automatic 60% LTD enrollment. Does that happen if the employee doesn't choose the 50% or no percent option? Oh, okay. So employees that are newly eligible are going to automatically be enrolled in the 60% long-term disability. The only way they can change that is if on that LTD enrollment form, they select the box that says 50% or I don't want it, I'm going to decline it. So we are hearing from BAs that, on that form, there is a check spot, one box checked already, and it says employer coverage. So lots of times employees get confused by that and they think, oh, well, it's already been selected for me. I'm just going to sign and date this and turn it in. But really, they need to be electing the 60%, the 50%, or decline. And if you see that with a newly eligible employee that they haven't, we recommend that you reach out to them and ask them what they want, because if they don't fill something out or get back to you, then they are automatically enrolled in the 60% plan within that 30, after the 31 days. So I hope that answered your question. And it looks like that the rest of them are just wanting copies of the presentation. Okay. Well, thank you everybody for attending, and enjoy the rest of your day.